And we do have some challenges. We have some challenges in the healthcare field. I know many of you have read about some of the initiatives that we've had to consider this year. We had the provider fee that we passed early on. I give Governor Deal a great deal of credit for the leadership that he exerted on a very difficult issue, but a necessary issue. And I give a lot of shout out to the members of the Senate and the House for, in this politically volatile time, stepping up and doing what was absolutely the right thing to do by passing Senate Bill 24 so that we can keep hospitals open and so that we can take care of the most vulnerable in our state, including infants and children who depend on the resources generated by that program. We have some shortfalls in the Medicaid program, and Chairman England and his committee are addressing those, and I know that they're going to address those in a fiscally responsible way, and I'm looking forward to looking at what the document that comes out later this week or next. Healthcare challenges, and I mentioned this a little bit in the budget, in talking about the budget, but we have had some healthcare issues on the table this session. I mentioned the provider fee. There's been a lot of discussion about the establishment of a state exchange. The governor looked at, and we joined with him in looking at the rules and regulations for doing that, and it was our determination jointly, which I still support, that there was insufficient flexibility for us to create an exchange here in Georgia that would truly allow us to create a market that would be really adapted to the needs of our population. The other part of the healthcare discussion recently has been that of the expansion of Medicaid. Many of you will know that under the Obama healthcare plan, it provided for a partnership between the federal government and the states for those states that wish to expand their Medicaid rolls. Now, the Supreme Court ruled they didn't have to, but it was an option. Under the guidelines that were established by that law, we would have added, we have 1.7 million Georgians on Medicaid today. This would have added over 625,000 more Georgians at greater cost. The federal government would have paid all of the expense for the first 3 years of that, and then their percentage would have dropped off. And we're having this discussion, though, about them paying part of their percentage at a time that we're having discussions about them cutting trillions of dollars out of federal spending over the next few years. And it seemed to me that it was not a wise course of action for us as Georgians to expose the people of Georgia to that sort of an expansion of this program with those drastic budget cuts looming. There's another part of that that really doesn't get discussed a lot or enough, and that is that there is a difference between access to coverage and access to care. We have in Georgia, and this is something that we can't be proud of, but the reality is that we rank 41st out of the 50 states in the availability of primary care physicians per capita. Which means we can expand coverages all day long, but if we don't have primary care physicians and other qualified health professionals available to care for this population, then we're not doing ourselves very much good, nor those that we're attempting to serve. One of the things that we're going to do, and have started in the House, is to take a more aggressive look at how we can utilize managed care in more of the Medicaid populations so that we can better and more effectively serve those populations, but utilize our dollars in a more efficient way. And we're going to be looking at that. We have started the process of creating a joint commission to do that beginning immediately upon the conclusion of this session, if we can get that resolution passed. And I'm optimistic that we can put some momentum behind that idea, which I think is sorely needed for our healthcare future. So that's kind of some of the issues that we have out there. There are a myriad of others. I will be happy to talk about any of those if you have questions about them, and I'll be happy to stop here and take your questions. I have a kind of a simple rule on questions. You can ask me anything, but I don't have to answer them. Oh,
Mr.
Mark.
Speaker, Mike Klein with the Georgia Public Policy Foundation. Senate Bill 141 discusses medical malpractice reform. Could you talk to us about what you think might be possible in the medical malpractice reform arena?
I got to be truthful with you and tell you I haven't read very many Senate bills right now. And I don't say that to deride those. I'm focused on about 400 House bills that we're looking at right now, so I'm not sure what the content of that is. You know, from time to time, we passed a big medical malpractice reform back in 2005, you know, I've heard a little bit of discussion within the General Assembly that there's some interest in that right now, but is that bill passed the House or the Senate? Mm-hmm. Still in the Senate?
Committee.
Okay. I mean, I'll take a look at it. We'll look at it certainly if it comes out of the Senate, it comes over to the House.